Hello, my name is Jeff Patterson. I'm the Chief Executive Officer of Nacogdoches Medical Center, and welcome to another episode of Ask a Nac Doc. Today I have Dr. Kathleen Querry with us from the Wound Care Center. Welcome.
Thank you.
We have a lot of questions today for her regarding Diabetes Month, as well as what the Wound Care Center does and different treatments we have. So first, to start off, what does the Wound Care Center provide here in Nacogdoches?
So we provide a multidisciplinary approach to advanced wound healing for our patients that have non-healing wounds, and Medicare defines a non-healing wound to anything that doesn't heal over 30 days.
And that can happen in any patient, but with Diabetes Awareness Month, tell me about how wounds affect diabetics.
Yes, it can happen in any patient, from spider bites to non-healing surgical wounds in our diabetic foot patients. So diabetes affects about 37 million patients in the US. That's 1 in 4 adults suffer from diabetes. In our clinic last year, our main indication for people to come into the clinic was for diabetes as their primary etiology. It makes up 35% of our classification of all different types of wounds. So that's the highest one we have. But once the patients are healed, they run the risk of actually getting another ulcer within 1 year, and that's about 40%. So we try to teach them upon discharge good foot care, good skin care, how to make sure that they watch for calluses and cracks and take care of their skin so that they don't get another ulcer. Because diabetic patients have a high risk of neuropathy. About 60% of patients get neuropathy, and the diabetic patient has a much higher risk of cardiovascular disease. It's about 4 times higher than your and I's risk would be, okay? So we see a lot of those patients also. The root cause of diabetes is blood sugar, but these other complications come about because the sugar gets coated on their vessels, it gets coated on their tendons, it gets coated on the nerves, and those don't function appropriately, and so they change over time. And one of the things that happens is with the neuropathy, they develop calluses from friction, and they don't feel bad. And callus is just a buildup of dead skin cells. And eventually that callus will rub enough that it will separate from the live tissue and form a pocket of fluid. And then that will get infected and it will rupture open. And the patient will come in and say, I didn't even realize I had a problem. And now all of a sudden I have this drainage on my sock and it smells really bad. My wife is like, what's the smell? What's the smell? And that's how they present. Or they'll take their sock off one afternoon after working, all of a sudden the tip of their toe is black and they don't think anything about it, but the next day it's more black. And they come in and they say, I don't understand what this black spot is, because they have bad blood flow. So we have to reach out to our vascular surgery partners, our cardiovascular guys, to help with intervention in that department. So it's a multidisciplinary approach, and as far as trying to prevent amputation, and the statistics show that a wound care center of our sort that uses advanced modalities can decrease amputations by about 50%. We try to beat that number personally, but we're at 79 right now.
As you can see, we're very fortunate to have Dr. Kathleen Querry here at our Wound Care Center in Nacogdoches. The tools that she uses to help our patients heal their wounds are second to none, and we thank you for your time today. And we also thank you for joining us for another episode of Ask a Nac Doc. See you soon.